Welcome to Dateline Health. This is Fred Lippman coming to you from Nova Southeastern University. And as I was just saying to my guests, we get all of our thoughts relative to show issues, what you want to hear about. And this is one issue that we get a lot of requests for information. And that's the issue of diabetes, control of diabetes, what is diabetes, why do I have diabetes, etc. So we got two excellent individuals. We have Dr. Arnaldo Villafranca, who is an endocrinologist, and he's right here in our neighborhood. He's on University Drive between Pines Boulevard and Johnson Street, if I remember.
That's right.
Welcome, doctor. Welcome to being here. We really appreciate you being here.
Great to be here. Thank you.
Good. Thank you, sir. And a return star. We got a return star. Alix Landman, who is a registered dietitian. She's got an MPH, and I don't know what CDE is. You're going to tell me. And she's the lead person at Landman Associates, and she deals with diabetes management, prevention, treatment, etc. Welcome.
Thank you. Thank you for having me.
Tell me what CDE is.
It's a board-certified diabetes educator.
Aha. There we go. Didn't know that. Well, doctor, may I call you Dr.? Well, I'll call you Dr. Villafranca. It's all right. That's a very beautiful name.
Thank you.
Tell us what an endocrinologist is.
Endocrinologist is a doctor that deals with hormones. Most commonly is diabetes, thyroid conditions, testosterone. There's different types of hormones. But any disorder in this field. The majority of my patients are diabetics, mostly type 2 diabetics. Obesity, hypertension, cholesterol issues are all related with the diabetes.
Let's talk about for a second, and let's give the people some definitional issues. They hear about type 1, type 2, type 3 diabetes. Tell us the difference.
Well, for type 1, it's most of the time it's a younger person. It could be older, but it could be a younger person most of the times. It's a person who doesn't make insulin. So the body attacks the pancreas. The pancreas doesn't make insulin. They're insulin dependent. That's the type 1. Type 2, people have insulin production. The body doesn't stop making insulin necessarily, but it's more associated with obesity and insulin resistance. So that has to do with they have the insulin in their body, but it's not effective compared to someone who doesn't have diabetes. So in that case, they might need pills or insulin. It could be one or the other, or a combination of both.
And of course, diet control.
That's the foundation. Yeah.
And that's why we got Alix Landman here, who will talk to us about nutritional intake. Right, Alix?
Yes, I will.
Okay,
Thank you
you're
very
on.
much. Nutrition plays a huge role, and usually, if not properly addressed, will end up leading someone who has the predisposition towards diabetes to actually get diabetes. And with the abundance of food that people have, and without having good coaching and professional education, they are left to their own devices. Whatever their cultural norms were, whatever they grew up with, they're going to usually continue that. Whether they have a lot of money to buy food or they don't have a lot of money to buy food, their diets end up having a very similar pattern when they get diagnosed with diabetes. They usually don't have adequate fruits and vegetables in their diet. They usually overeat on the carbohydrate load of foods, which are starches like rices and pastas and crackers, breads, cereals, and they are not aware that they need to learn more about these foods and how to manage them within the context of the diet. Usually there's a lot of sugar in the diet. We have a tremendous amount of liquid calories coming in with fruit juices and soda. And a lot of people are going to big buying clubs to get deals, right? So if there's a 2-for-1, people will be buying huge liters of soda, and it's not necessarily good for them, but it's a good buy. And on the other end, their diets usually are rich in fried foods and chips. If they are doing what they did from when they grew up, they're eating fried chicken, and they're eating French fries, and they're eating lots of fried foods. And so the combination of lots of carbohydrates and fried foods and not enough fruits and vegetables starts to create the foundation for an abnormal hormonal response, more insulin resistance, and a faulty mechanism for managing the total load of glucose that ends up showing up in their bloodstream from the totality of what they're eating. So they really need better education and simple information, how to shop better at a good cost so that their foods can be cost effective and they can make simple meals. And if they're eating out, what are the smarter things they can do so that they can work with their doctors if they already have the diagnosis. And better yet, since diabetes predominantly, especially with type 2 diabetes, a lifestyle disease, meaning what they eat and what they're doing activity-wise really moves them into the diabetic realm of that diagnosis, that it's reversible. If it's caught early enough, it's reversible. Even when people have diabetes, they can do a lot of things with their diet every day that can actually help them improve and maybe from being on medication, not being on medication. So it's a fantastic, exciting thing to learn about. And when people start to learn about how they can control their own destiny and their health, they get very excited about it. In fact, the CDC 10 years ago started a diabetes prevention program that now is all over the country. And there are over 1,000 facilities that are accredited to actually run this program. And it's a 16-week program that people can go and learn about. On a very simple level, whether people go to their health department, there's diabetes education there. Whether they have insurance base, they can get education there. But if they ask their doctors to refer them to a qualified dietitian that can help them coach them with their diabetes, they can get education there. And there's a lot of free resources in our libraries, on the internet, and I've brought some free resources that are credible, that are evidence-based, which is what we're interested in. We want people to get the right information of how to proceed with simple, healthy, day-to-day nutrition. Breakfast, lunch, dinner, snacks.
You know, there's so much I want to get back to you on in just a minute, but I want to put myself literally in your chair and say you have a number of people that refer to you. You have the family physician, the internal medicine doc, the OBGYN, the primary care physicians or otherwise, or even it ends up with some of your subspecialists, a cardiologist or otherwise, something turns up in their blood profile.
Yep.
And they refer to you as an endocrinologist. It must be almost, it must be almost impossible sometimes to get through to individuals to the fact that this is really what's wrong. Tell me if I'm right.
There's a lot of patients that deny the condition, that they don't accept it. So a lot of times it takes a few visits to kind of get them to understand what's going on in their body. Diabetes is a tough condition because people don't feel symptoms many times, so they think everything is fine. But I try to tell them about the complications that could happen, the nerve damage that could happen in the hands and feet, the kidney damage, sometimes ending up with dialysis, the vision loss, some people end up blind. So the more education people have, the more they accept this as a serious condition, and the more actions they take early on, starting with nutrition. That's the foundation of the treatment that we try to focus on. But many times a lot of education, repeating things and trying for patients to understand what's going on. They feel more comfortable with the disease and more acceptable to make aggressive treatments to prevent complications.
You know, we did a show recently on cardiovascular disease, and the cardiovascular surgeon and the cardiologist were both sitting here, and both of them in their discussions talked about how the comorbidities that are created by diabetes show up so often in their realm. Particularly, we have probably the largest percentage of 80-year-olds of any cohort of population in the United States living right here in South Florida. I would assume that you see a lot of that.
I do, yeah. We try to focus on prevention, though. I mean, instead of coming in for once you have in the dentist case, the toothache, or in my case, I had a patient that came in with toes that were already turning darkish color. So instead of coming in when there's complications, get your annual checkup, at least with your primary care doctor. If you see the sugars are a little bit on the high side or already pre-diabetic, consider seeing a nutritionist, get aggressive treatment from the beginning. work on weight loss, diet, exercise to help reduce the progression of the condition. But that's the main thing we should focus on. Besides treatment, we should put a lot more effort in the medical profession in prevention of the progression of diabetes and complications.
Well, that's why we asked Alix to be here, because I remember very clearly, it was a totally different subject, but we got into it. Because, and you mentioned it when you talked about shopping, it's very difficult for people to read labels and know what really is harmful. You know, they say, you go down a cigarette, I remember, I go down a cereal aisle in one of the large supermarket chains, and you go and you see all these things, no sugars, no sugar, no sugar. But then you turn onto the label and you see what is really there. It doesn't say sugar, but it has substances in there which turn into your body, and once they're in the body and they are broken down, they're sugars.
Well, we're talking
about it.
Total carbohydrates, and I want to say a couple of things. We're having a new label come out, and the new label is going to make things a lot easier. That probably should show up in 2017, and I think the deadline for all manufacturers is 2018. And it's going to tell right on the label in very big type how much actual sugar. People will not have to do the math right on the label. So that's great. The next, and do not underestimate that big business that has a lot to lose from being found out how much actual teaspoons of sugar are on their label are now going to be exposed. So there's been a lot of political backlash from that, but it nevertheless will come out, and it will be a very different, it'll look the same, but all the numbers are going to be different and much more clear. So it's sort of the food label for dummies now. It's a really much more effective label. And the thing that you're talking about where it says no sugar, when we're talking about diabetes, we're really interested in total carbohydrates. So too bad I don't have a label that I can show you, but there's three major macronutrients on a nutrition label. There's protein, fats, and carbohydrates. And those are the main things that are put on a label because they provide calories. So when we see total calories on the top, they're referring to those three macronutrients. Carbohydrates is the thing that we focus on the most when people finally find out that they have diabetes and they're reading and they start learning, oh, I need to start learning what carbohydrates are and I need to start controlling them. And if someone also wants to do more prevention because their mother or their father or their grandparents or their aunts and uncles have diabetes and they don't want to get it, they start looking at, okay, let me write down everything that I'm eating and let me see where my carbohydrates are. And if they're not sure, they can literally type it all into the computer. Even if you just do a Google search, how many carbohydrates are in soda for 24 ounces? And you'll pick it up. Yeah, I mean, it'll show you. It's fantastic, the resources that are free today. And if you don't have a computer, go to the library. They have computers, and you can do any of this work. So as far as understanding more about labels, it's a simple, like if I had a label here in 10 minutes, you could become an expert on labels. One thing that's important about carbohydrates, we have refined the heck out of them. So when we look at sugar that's in soda or sugar that would be in a fruit juice, it didn't grow on a tree like that. It came from a former source that we had to refine. And the body doesn't want refined carbohydrates because we absorb them very fast and we have a very quick glucose excursion. If we're eating the actual orange rather than orange juice, even though many people that may be watching your show said, but I grew up with orange juice, isn't it supposed to be good? That's what I take all my medicines with. But if we look at a glass that size, and that's 8 ounces, that's equivalent to 2 fruits right there. And I'd rather people drink water or herbal teas as their beverages and no calories, not even artificial sweeteners, because that does something to your brain that actually makes you crave more sugar. Just water, and then eat whole carbohydrates in terms of fruits, like 1 orange or 1 apple or 15 grapes or half a banana, or learning about their carbohydrates in terms of rice. If they're going to eat rice, switch to brown rice, because the fiber, and this is what I was going to say, if you look at a label and you see that there's 90 calories and it's all coming from carbohydrates, if it was not a refined food, if it was a whole food, then that product's going to have fiber in it. But the worst thing we can put in our body is carbohydrates without any fiber. A good example is an 8-ounce glass of juice. That has 120 calories, it has 30 grams of carbohydrate, it has no fiber. If we're drinking a can of soda, a 12-ounce can of soda, any type of soda, it doesn't matter, whatever brand you pick, it has about 40 grams of carbohydrates, about 150 calories, and no fiber. The body is waiting. It's like once we drink it, the body, hey, dude, where's the fiber? You know, you came from somewhere, what'd you do with it? So it's waiting for the fiber because the fiber slows down the ability for that to be absorbed in the gut and then going right up to the liver. The liver all of a sudden receives this load, and it's like playing a Tchaikovsky's concert in 10 minutes. It's not designed to do that. So all of a sudden it gets a quick text to the pancreas. The pancreas has to secrete insulin. It's like, hurry up, guys, come on, we got to load. We got, like, you know, supposed to start at 11, and now it's starting at 10, and you're late. Okay, so the point is that its job, once that glucose shows up and the liver's got to send it over to the blood, it's got to do it fast. So we want to put in foods slower. But I want to make a point to what Dr. Villafranca said, is that access. How are people going to get access to dietitians when Medicare waits until someone gets sick? They cannot come. We get calls, at least 10 calls a week, for people that have hyperglycemia, but they're not diagnosed with diabetes, and they won't pay. Medicare won't pay. And Blue Cross Blue Shield follows Medicare, so they won't pay. So they wait until they get sick enough, and then they pay. And so we have an access problem in our country, a tremendous, terrible access problem. The professionals, we as professionals, need to be right in the primary care setting, and a 10-minute consult with a dietitian will help tremendously this country when they go to see at an annual visit, because we'll pick it up right away. We can already predict from what they're eating and what their activity is or not, that if they have this as a predisposition or in their family history, because you get 50% of your genes from your father and 50% of your mother, so that is a predictor right there, that if they do not change the trajectory of what they're doing at an earlier age, then they're pretty much going to progress to this.
Okay. Dr. Villafranca.
Yes, sir.
Patient sees you. They, of course, today, and I've had this discussion with individuals like Alix Landman here about the obesity issues that we have. I would assume that you're seeing a great number of people who, unfortunately, are not only medically obese, but obese. And it does reflect upon their endocrinologic profile. Talk to me about that.
Yeah, with obesity?
Yeah, anything. Obesity and diabetes.
Well, they kind of go along together, especially thinking about the genetics component of it. People may be predisposed to have diabetes. And then you think about the eating habits. They grew up culturally eating a certain type of food. The younger people follow the same habits. They're predisposed to get diabetes. So with the weight increase early on in life, you get diabetes much quicker. It's true. I mean, the genetics plays a big role in it, making changes right away, especially from the diet perspective. And even medicines. There's some medications that are preventative for the progression of diabetes. Metformin is a very common medication used out there for this purpose, not only for diabetes, but for pre-diabetes, besides the lifestyle changes that we need to make.
You know, I have you here, and I don't want to, I know we're focused on diabetes, but I don't want to go without touching on thyroid issues. There's such a unbelievable number of thyroid issues relative to creating deficiencies and diseases, including a lot of mental health issues. And people don't know that. People don't know that for many, many decades, prior to, I guess, the 1960s, a lot of people were incarcerated, and I say that in as kind a way as I can say, in mental health institutions because they were hypothyroid, not hyperthyroid, and they were confused. Do you see? Of course, you do a lot of work with thyroid issues.
Yes. Yeah. If you're having symptoms, confusion, weight changes, sometimes weight increase, constipation, diarrhea, feeling very hot, very cold, energy levels on the low side, ask the doctor to check out the thyroid panel. Replacing that hormone could lead to a much improvement in activity and how you feel. Sometimes the weight gain it's not just because of what you eat, but it's a hormonal issue like thyroid. So definitely something to check out. If you're having any of those symptoms, ask your doctor to check it out.
Yeah, I just didn't want to go by. I have a well-educated endocrinologist sitting in front of me, and you know, there's been so much recently that I've been talking about issues relative to mental health, and that a lot of people have not connected yet with the fact that some of these things are created by not just their environment, but by their body chemistry. Correct?
Yeah, yes. The most common cause of low thyroid is an autoimmune condition where the body's immune system attacks the thyroid. Many cases I get called to the hospital for these cases, and many times there may be elderly people that are confused, and then they check the thyroid panel, they're very low, and then need replacement either by intravenous or by mouth. But just replacing that hormone, they feel like their normal self again, they're not confused anymore. It makes a big difference, that hormone.
Let me just touch on one more thing since I have you in front of me and we're talking about this. Thyroid in itself, the thyroid product that you're putting into the body, there are different fractions, correct? Yeah. And often medical application of certain pharmaceutical products only lead to replacing one fraction. What do you see much of that, or how do you deal with that?
I see a lot of that. The most common way to replace it is just one fraction of thyroid hormone. That's what the guidelines kind of talk about. I think more and more studies are coming out that maybe replacing all the different types of thyroid hormone may be beneficial. Some people use a different form of thyroid replacement, which is, I guess they consider a more holistic form, and that has many different components in it, and they feel better. So there's a lot of research going out there that what's better, just one component versus a combination of multiple components of thyroid hormone.
Can I introduce something?
Sure, that's my intellectual curiosity. Go ahead.
Levothyroxine is T4. And the assumption is, and what happens in the body is, as we know, it gets translated into T3. The key nutrient that does that is selenium. And many people are deficient in selenium because it comes if you're only eating whole grains, or if you're eating, it's rich in Brazil nuts. Well, who's eating Brazil nuts? And many people need to start switching to more whole grains, but still it's not adequate. The RDA is 200 micrograms. So we find that that in and of itself is a deterrent from a full translation from T4 to T3. T3 is the 80% active in the body, and T4 is the 20% active. So in a compounded formula, or they used to give Cytomel, which was T3, they used to give that directly. But when we correct the diet, and especially in the Hashimoto's form of thyroid or hypothyroidism, where we have an autoimmune issue, we're seeing a lot of issues related to gut health, dysbiosis, and gluten and gliadin fractions, which are proalamines that come from wheat, barley, and rye. They're having a tremendous benefit when they are substituted for other grains and starchy vegetables that are carbohydrates, and move away from those foods, where we can have a much improvement in the labs that we see in patients that are diagnosed with Hashimoto's type thyroid problems. So a dietary approach can have a tremendous improvement on autoimmune type thyroid, and there's a connection between thyroid and diabetes. That's a very common connection, as the autoimmune aspect can also affect the beta cell. And so you can actually have thyroid starting first many times, and then 10 years later, we see a diabetes onset.
I'm going to have to stop you right here because we're down to the last 2 minutes of the show. And I want to ask Dr. Villafranca, again, you're talking to the audience now. Okay. You want them to obviously have their primary care physicians, see them minimum of once a year, and do full blood panel. Yeah. So that the information could be available to you. What information do you need from those blood panels?
So for the annual checkup, it's good to check sugars, kidney function, liver test, hemoglobin. If the sugars are high, they should get a test called the hemoglobin A1C. That's a 3-month average blood sugar. That could be, you get it from the blood test, and you get to know what the overall average has been. From that, you could help diagnose diabetes or pre-diabetes. If you do get in that range of diabetes, consider seeing an endocrinologist, or maybe the primary care is well versed with diabetes. But the main point is to start early, make sure not to get your annual checkups, make sure many years don't go by and then you're full-blown diabetic and you need aggressive treatment. So.
And also a full thyroid panel.
Thyroid,
correct?
yeah. Thyroid
Right.
should be done once a year also.
Right.
Yeah.
Okay.
Especially
so
if they have symptoms.
We're down to the last minute of the show. So thank you very much for being here. And we're going to ask you back because I do want to get into the issue of over-the-counter products and integrative medicine. And we're going to bring you back. Does that be all right?
I would love to. I would love to bring my fruits and vegetables, which is the best integrative medicine there is.
That's fine, but we'll
Show
have,
people
we'll
what
have
they
to wait
can eat.
until the next show.
Okay.
Okay, and Dr. Villafranca, one more time, thank you very much. I know your office is on University Drive,
University Drive between
Pines and Johnson, right? And people, obviously the people are referred to you by their primary care physicians, and people are not referred to you because they do, the doctors do, but they can walk right into your practice, correct?
They can walk in, and we have a lot of referrals because we take
Right.
insurance.
And you're in Plantation, correct?
I'm in Plantation.
Right, okay. So folks, we try to give you a whole bunch of information today. Hopefully it was of value. If you have any questions, you have any comments, there's an email address and a telephone number. Please feel free to let us know and we'll pass them on to the experts here. I always say to you, take good care of yourself. That's the most important thing. And in taking good care of yourself, you've got to see your doctors once a year, get the blood panels. You have to be a little bit more cognizant of what you're eating, not only from the store, but where you go out to eat in restaurants and fast food operations and things of that nature, and what you drink. Remember, especially in our hot area, we have to hydrate. So thank you once again for showing up. Remember, this show is called Dateline Health. We come to you from Nova Southeastern University. My name is Fred Lippman. Until next time, see you.